Well, 111 has grown from the concept in 2010. We launched 4 pilots. We're now at the stage where 16 million people a year are calling 111 as their principal route into urgent care services. But the key component for all of this is our workforce. Clearly, without a trained and skilled workforce that we can retain and reward appropriately, we just do not have a good 111 service. A motivated workforce has been vital. One of the criticisms for 111 in the past is that we've recruited relatively junior staff, but now we've got a career path that's described for people that can come in as a call handler, but may have aspirations to progress onwards into even into clinical roles.
I've progressed here from being a call advisor. I think it's massively important for the call advisors to progress and to sort of develop within their own role as well. A call advisor can be quite, sometimes you take a call, then you take the next call, and you take the next call, and it's quite nice for the call advisors sometimes to have that time offline where they can come off the phone, where they can sort of develop new skills like for an SCA, or they can coach somebody like a new starter or something like that. So it's good for them because it sort of mixes it up a bit for them as well.
I think recruitment and retention are 2 fundamental issues for the integrated urgent care system. And I think the Workforce Blueprint will really help us in terms of improving our recruitment and retention. It provides people with a really clear framework for where they might sit, whether that be in a clinical role or in a non-clinical role, right the way from bands 2 up to bands 9. So I think it provides a real clear depiction of the employment opportunities available to people and gives them a vision for the future in terms of how they might develop their careers.
To ensure that all of our workforce across the system has access to the right training and the right development at the right time, to ensure that we have an integrated multi-professional workforce capable of responding to the needs of an evolving, ageing patient population. For our programme in particular with urgent and emergency care, what we're looking at is pathways, so truly defined development pathways with staged entry and exit points that recognise the need to progress the career of a clinician, but at the same time respond to workforce need. So there is a balance between what the individual wants in terms of their aspirations and their own personal development needs, and what the workforce needs from them.
Things change quickly in this role. So be it if you start off as a call taker, if you're doing well in that role, I think we as an organisation are very keen for you to then pass on those skills and to perhaps have someone sat with you and perhaps do a bit of coaching with them. If you're displaying the right attitudes and you're performing well, there's a kind of a responsibility on the individual who's looking to get involved in that to kind of put themselves forward to do it. I think there's always room to develop within that role.
The workforce are just like members of the public. They've got holistic needs, and you have to think about their career development, their professional education, feedback and development, but also their mental health and well-being. The Workforce Blueprint provides all of these things in one package to help guide providers, supported by commissioners, in getting everything in place to support that most effective workforce, who in turn can support the callers and the patients presenting to the 111 telephone number.
That suite of documents really gives the provider all the information that they need to go out and hire the right sort of staff, to train them and develop them in the right kind of way. So we're starting to see changes already, and having this more diverse skill mix allows us to make sure that patients are getting the right sort of care from the most appropriate individual, but also in a cost-effective manner.
I can take information that I obtain from different levels and different services, and I can look at how we can improve things. I can speak to the different staff, and then I can take those opinions and those ideas to senior managers to be able to look at improving things. Everyone's welfare is looked after, everyone feels like they are recognised for the different skills that they perform every day. Helps to ensure that they feel safe at work, they feel safe providing the care to the patients, and that everyone's happy at what they do.
We looked at the blueprint and we look at how that fits with our strategic vision for integrated urgent care across the region, and use it as a framework for non-clinical and clinical development. We've got to absolutely utilise our workforce and their skills across the system and break down some of these organisational and clinical barriers around and how we work.
Cradle to grave, I know that's a mantra of the NHS, but that's what the IUC clinical assessment service has to be available to respond to people from all walks of life, all ages, all backgrounds. So it's really important that we have the right workforce, the right skill mix, a multidisciplinary team within that clinical assessment service to support patients who call 111 with urgent care problems.